Welcome to the Wolfpack Fitness Podcast with your host, Adrian Wolf. I'm a PhD student in interdisciplinary health sciences with a master's degree in kinesiology and a bachelor's degree in psychology. I've been a fitness coach for over 10 years and I've trained everyone from everyday gym goers to kids to Division I collegiate and professional athletes. My mission is to provide you with actionable knowledge in the areas of fitness, nutrition, stress management, and psychology to help you live your best life every day. Let's get to the show. What's going on, Wolfpack? Welcome back to another episode of the Wolfpack Fitness Podcast with me, your host, Adrian Wolf. If you're liking the content I'm providing, please pause this episode, follow my podcast, and submit a quick rating if you're listening on Spotify, or a review if you're listening on Apple Podcasts, and this will help me reach more people. I want to thank you for continuing to listen and helping me grow my podcast. Before I get into this episode, I want to make it known that this podcast is separate from my teaching and research roles at the University of Nevada, Las Vegas. In this episode, I discuss 3 of the most surprising benefits of muscle that you may not be familiar with. There certainly are many, but I want to focus on some of the most important ones that have the largest impact on your health. I start off the episode by talking about common themes I have witnessed regarding muscles that often prevent people from realizing the full potential that possessing an adequate amount of muscle mass can provide. Then I get into a fascinating discussion on the 3 different types of muscle and how they work. Then I transition into skeletal muscle, the type you are most familiar with, and I help you understand the 3 surprising benefits of this type of muscle and why you shouldn't be afraid of building an adequate amount of muscle and maintaining it. I finish off the episode by providing you with some suggestions for how to build and maintain muscle and strength, whether you have never performed resistance training before, or if you are a novice or even advanced lifter. So let's jump right in. Throughout my career in the fitness industry, I have noticed a few common themes when it comes to the development of muscle. I want to emphasize that although these are common themes, they do not apply to everyone. They are just what I have typically witnessed from my experiences working with many different clients of varying backgrounds, and what is commonly discussed in the fitness space. One of those themes is that men typically want to gain muscle to look a certain way, like looking shredded, having the six-pack, or big chest and biceps. Another theme with women is that many, but not all, tend to be a bit concerned about putting on too much muscle and looking bulky. Both of these themes have one very important thing in common. They are more so based on looks, also known as aesthetics, rather than health, or how a person feels. Although focusing on aesthetics can lead to what you want in the shorter term, which is to look a certain way, this can also lead to an unhealthy relationship with exercise, or focusing on less than ideal forms of exercise that may not be the most beneficial for your long-term health. So what can that look like? An unhealthy relationship with exercise can look like obsessing about every little detail regarding your workout routine, being too hard on yourself for missing a day or 2 at the gym last week, or it may even spill over into other parts of your life, like worrying too much about getting the exact proportion of macronutrients and calories you think you need at every meal. These relationships are common with physique athletes or bodybuilders who are training for a competition, for example. Focusing on less than ideal forms of exercise that may not be the most beneficial for your long-term health might look like excessive cardiovascular training, like long-distance running or several hour-long spin classes throughout the week, while neglecting resistance training. There certainly are benefits to these cardiovascular forms of training, but completing hours and hours of repetitive exercise in constrained ranges of motion, day after day, week after week, can lead to some problems long term, like stiff muscles, joint pain, and overuse injuries. Since these themes are so common in the fitness space, the goal of this episode is for you to open yourself up to another way of thinking about muscle and why it should not only be viewed at one end of the spectrum as something that makes you look attractive, common with men, or at the other end of the spectrum as something that you should be afraid of developing, common with women. I want you to start viewing muscle as a necessary organ that contains numerous beneficial properties for weight management, everyday functioning, and overall health, with aesthetics being a byproduct of developing optimal strength and function. To start off, I'm going to get into a discussion of how muscles work. Then I'll take a deep dive into the many surprising benefits that having an adequate amount of muscle can provide you, whether you're a man or a woman, athlete or non-athlete. So let's talk about how muscles work and the different types of muscle. Yes, there are, in fact, different types of muscle. There are 3 different types: smooth muscle, cardiac muscle, and skeletal muscle. So smooth muscle is located in various organs of your body, like the digestive system and your blood vessels. This type of muscle isn't under your voluntary control. It's activated by the autonomic nervous system, which is part of the nervous system that controls involuntary functions. So you have this type of muscle in your small and large intestines within your digestive system to shuttle food throughout that system without you having to even think about it. Imagine if you had to consciously think about moving food through your digestive system all day long. You probably wouldn't be able to get much done. A similar thing happens in your blood vessels with smooth muscle. It's located in the middle layer of your blood vessels, known as the tunica media, and it contracts and relaxes unconsciously with the help of certain hormones to either vasodilate, which is to open up, or vasoconstrict, which is to close the blood vessels, to control blood pressure and blood flow to certain areas of the body. So that's smooth muscle. It's deep in your body, not visible from the outside, but it has important functions. Next is cardiac muscle. You probably can guess where this type of muscle is located. That's right, in the heart wall, also known as the myocardium. This type of muscle is also under involuntary control, and it's stimulated by parasympathetic and sympathetic nerves. So parasympathetic nerves help to slow the heart rate down as part of the rest and digest response, and sympathetic nerves help to increase the heart rate as part of the fight or flight response. Interestingly enough, there are certain things you can also do consciously to stimulate either the parasympathetic nerves or the sympathetic nerves and influence your heart rate. For example, taking a long, slow exhale after a deep breath in will slow your heart rate, while consciously hyperventilating will increase your heart rate, but I don't recommend doing that. I just wanted you to understand that these nerves, which influence heart rate, can be somewhat consciously manipulated to influence the rate at which your cardiac muscle contracts. I'll talk more about this at some point in a later episode when I discuss how you can use breathing techniques to manage your stress levels. The last type of muscle that you can see the shape of, if you are lean enough in certain areas of your body, is skeletal muscle. This is the type of muscle I'll be discussing for the remainder of the episode. So skeletal muscle is located everywhere throughout your body, and it's attached to your bones or skeleton, hence the name skeletal muscle. This type of muscle is attached to your bones through a particular type of connective tissue known as a tendon. As your muscles contract, they pull on the tendons, which use the bones as anchor points to generate movement. You generally have one attachment site on a bone, although many muscles do have multiple attachment sites from different portions of the muscle. But for this discussion, I'll keep it simple with one attachment site. This attachment site that serves as the anchor point is known as the origin. So let's take the biceps muscle, for example, because it's a muscle that most people are familiar with. If you're not, if someone ever told you to hold your arm out and flex your bicep, that is the muscle that's located just above your elbow, and it makes a spherical or oval shape as you flex it. Your biceps muscle's origin is located on the front part of your shoulder blade, also called the scapula. So when you flex your bicep like you're doing a curl, your scapula doesn't move, your forearm does. That's because the other end of your biceps muscle is connected to your forearm, specifically the radius bone. This attachment site is known as the insertion, and whichever bone serves as the point of insertion will be doing the moving. So in this example, the scapula stays put and your forearm is pulled closer to it, closing the angle of your elbow, allowing you to do things like a biceps curl exercise, or picking your bag up off the ground and bringing it to your shoulder, or holding your baby close to you if you're a parent. The point is that you have skeletal muscles for a reason. Their primary function is for you to move around, to walk, run, squat, and pick things up. Their function is not to just exist and be pleasing to the eye. The society we live in has formed this perception of muscles that they just make you look good and serve no other purpose. On the flip side, society has also formed a perception that having too much muscle, referring to women typically, is unattractive, while completely ignoring the numerous health benefits of possessing adequate amounts of muscle, which I'm going to discuss soon. The two main points I want to make here before I get into the other surprising benefits of muscle are: 1. If your goal is to maximize your health benefits, you should focus on not just making your muscles big through bodybuilding, for example, but you should also focus on keeping them strong relative to your body size, and also mobile and moving well relative to each other, meaning smaller supporting muscles are doing their job well and are being activated appropriately as well. And 2, if you're concerned about putting too much muscle on or looking bulky, consider the alternative, which is being weak, frail, and not strong enough to support the healthy lifestyle you want. Remember, you can always change the way your muscles look and how much you have with appropriate modifications to your training program. There's a principle in exercise physiology known as the principle of reversibility, which simply states use it or lose it. In this context, meaning if you feel like your muscles are getting too big, you can reduce your training volume or modify your weights, reps, and sets to make your muscles smaller. Nothing is permanent. You can also have sufficient muscle mass and strength without putting on too much, which I'll also do an episode on at a future date. Okay, so let's get into the many surprising benefits of muscle and some cool stuff that the research has to say. I'm going to talk to you about 3 surprising benefits that you typically don't hear too much about when it comes to why having an adequate amount of muscle mass is important. The first is that having more muscle mass is an important contributor to your ability to survive extreme trauma. To be blunt, having more muscle simply makes it harder for you to succumb to death due to an emergency. I know this is an extreme example, but research has shown that individuals with limited reserves of muscle mass respond poorly to stressful events like severe burn injuries and cancer. I want to focus on cancer a little bit more, though, because I think we all know how prevalent it is these days. And I want to emphasize that what I'm about to say is not fear-mongering. I am simply sharing factual information based on peer-reviewed scientific research that I believe people should be aware of if they want to improve their likelihood of surviving a serious illness like cancer and reduce the risk of getting it in the first place. Research shows that a loss of muscle mass is known to be detrimental to survival from cancer. In fact, a study published in 2000 in the Annals of the New York Academy of Sciences showed that in patients with lung cancer, those who were able to maintain or increase muscle mass had a lower recurrence and higher survivability compared to those who lost muscle mass. Also, Other research has shown that in those with pre-existing deficiency of muscle mass before trauma, meaning those who had less than adequate muscle mass before a severe injury, the further loss of muscle mass due to the recovery of that trauma may push people past a threshold that makes recovery of normal function unlikely to ever occur. And in that study, the researchers showed that greater than 50% of women older than 65 years who break a hip in a fall never walk again. This is really important for you if you're an elderly individual who doesn't resistance train, or if you're just generally inactive. But it's also really important if you're younger, whether you're in your 20s, 30s, 40s, or 50s. If you start and maintain resistance training at a younger age, you can slow the rate of muscle mass decline. This decline in muscle mass with age is known as sarcopenia. And you can also maintain muscle strength as you get older. Not accounting for many other factors, keeping adequate amounts of muscle mass and strength will make it less likely that you succumb to a serious illness. But life happens sometimes, and even if you do succumb to a serious illness, possessing more muscle mass will help keep you from losing so much that it's even more detrimental to your recovery. The next surprising benefit of muscle is its role in the prevention and reduction of obesity. I'm going to go off on a short tangent here and talk about obesity before I get into how much muscle mass is related to it. Previously, obesity has been defined as a body mass index, or BMI, of 30 or greater for adults, and this is measured by dividing your weight by your height squared. But BMI is limited by the fact that it only takes into account weight and height, and not body fat percentage. Now, BMI is a good starting point for determining whether you are metabolically healthy or not, but where it falls short is particularly with larger athletes like powerlifters or football players, for example. These athletes are typically fit and active, especially at higher levels of play. So a high BMI doesn't necessarily reflect their overall health. This is why it's just a starting point. Testing body fat percentage and blood biomarkers, along with examining nutrition and lifestyle factors, also needs to be considered when determining how fit and healthy someone is. In fact, a new set of global clinical guidelines for defining obesity was released earlier this year in the scientific journal The Lancet Diabetes and Endocrinology. The journal commission, composed of 58 experts representing multiple medical specialties and countries, came to a consensus about more specific criteria for obesity. What they came up with was a more specific categorization of obesity into preclinical obesity and clinical obesity. Clinical obesity is the worst of the two, and it's defined as a chronic illness that results from alterations in the function of organs or the whole organism directly induced by excess adiposity, independent of the presence of other adiposity-related diseases, which means simply that it's a long-term ongoing illness that needs to be diagnosed, and it's present in people who have symptoms as a direct result of excess body fat, regardless of the presence of any other diseases related to the body fat. This condition is serious and can lead to life-threatening complications. Preclinical obesity, on the other hand, is defined as a physical phenotype characterized by excess adiposity and absence of major signs and symptoms of organ dysfunction due to obesity, which means that the person with this condition has more body fat than is required to be healthy, but they have no signs or symptoms in their organs yet. This is kind of like pre-hypertension or pre-diabetes, where you want to really start paying attention to your lifestyle and make sure you don't develop the serious issues associated with clinical obesity later on. What is good about these new definitions is that they go beyond just BMI to assess how healthy you are. Depending on your doctor, they should also look at your waist circumference, waist to hip ratio, waist to height ratio, or where available, direct body fat percentage measurement. So this is a good step forward in making the criteria for obesity and health concerns a bit more specific. But let's get back to how muscle mass affects obesity and even body fat percentage, if obesity isn't a concern for you. Research shows that the more muscle mass you have, the more energy it takes to maintain that muscle mass. If you're doing an adequate amount of resistance training to break down your muscles, which is the stimulus needed to repair those muscles and grow them, and eating sufficient protein to rebuild them and make them bigger and stronger, this will, to put it in simple terms, increase your metabolism by increasing your resting energy expenditure through the muscle repair process. And if you eat more protein, this also leaves less room for other foods like ultra-processed carbs and junk foods, which only serve to increase body fat. And here's something pretty cool. Research has also shown that for every 10 kilograms or 22 pounds difference in muscle mass you gain, that translates to approximately 100 calories extra burned per day, assuming you're maintaining the muscle through adequate protein intake. So, if you extrapolate that over a year, that translates to approximately 4.7 kilograms or about 10 pounds of fat mass lost. Of course, there are many other factors at play, but that's the impact that having more muscle can have on your health. The last benefit of muscle you may not be familiar with is its impact on insulin resistance and diabetes. The first important concept to be familiar with here is insulin resistance before we even start talking about diabetes, because diabetes develops in stages. Your muscles hold approximately 80% of your stored carbohydrates, also known as glycogen, and your liver stores the remaining 20%. Glycogen is a stored form of the simple sugar known as glucose. When you eat carbohydrates, they are processed through your bloodstream as glucose to get to various places in the body, including your muscles. When the glucose gets to your muscles, it can't just simply enter them unless you're exercising, which I'll talk about soon. But when you are resting, the glucose needs to be signaled to enter the muscle by a hormone known as insulin. Insulin is released by the pancreas, which is a long organ that sits behind your stomach when you eat carbohydrates. The insulin then travels to your muscles where it binds to a specific protein known as a receptor that's located near the outside of the muscle. Think of a receptor as a lock and the hormone, in this case insulin, as the key that fits into the lock to perform a specific function. When this happens, it signals a transporter protein known as GLUT4 to come towards the muscle surface and transport glucose inside the muscle for utilization or storage. This should happen very efficiently, but with a condition known as insulin resistance, your body produces so much insulin because of excess carbohydrates or a combination of other factors, including chronic stress, that these receptors become less sensitive to it by doing what's known as down regulation, meaning reducing the number of receptors available for insulin to bind to. This can eventually lead to excess glucose buildup in your bloodstream and eventually lead to diabetes, which is a very serious chronic disease, if it persists long enough. When you become more active or make lifestyle changes like improving your diet and reducing excess sugar intake, the opposite or upregulation occurs, where your muscles start to become more sensitive to insulin because there is less of it being produced, so more insulin receptors become available for it to bind to. So more glucose will enter the muscle out of the bloodstream. This brings me back to the point of how exercise and resistance training in particular can facilitate glucose uptake into the muscles and reduce your risk of developing insulin resistance or diabetes. When you contract your muscles, say by doing a set of 10 to 15 squats, for example, research has shown that insulin sensitivity and glucose uptake into your muscles and out of the bloodstream improves through an insulin independent increase in glucose uptake, meaning insulin is not required for glucose to get out of your blood and into the muscle. This also shows that it's not just the size or strength of your muscles that produces the most health benefits, but the way that your muscles function is equally important as well. Just by using your muscles more, whether it's through walking, running, cycling, weightlifting, or bodyweight exercises, you will improve their ability to keep your blood sugar and insulin levels at healthy ranges and reduce your risk of developing health problems. Since this episode was all about the importance of building and maintaining muscle, I'm going to finish up by providing you with some strategies for how to develop lean, supple, and well-functioning muscle through resistance training and mobility techniques. First off, a lot of which types of exercises you do to build muscle and strength depends on your current level of fitness and skill. Let me give you a few different hypothetical examples. More than likely, at least one of these will apply to your current situation. First, let's say you have absolutely no experience with resistance training whatsoever. And when I say resistance training, what I am typically referring to is overcoming some sort of external resistance, usually in the form of weights, like dumbbells, barbells, or kettlebells, but not limited to just these. An example of resistance training that doesn't utilize an external weight would be a suspension strap row, where you hold onto the straps, lean back, keep your body in a straight position from head to toe, and pull your chest to the strap handles. In this particular case, you are overcoming your own body weight, which is the resistance, to pull yourself up, thus developing your forearms, biceps, and back muscles. So if you have no experience with resistance training, it will not take much to build muscle and strength. Here are a few things you can do to start. And please keep in mind that the suggested repetitions are generic because your individual situation is unique to you, so you may need to do a bit more or less to achieve the results you want. First, you can walk up and down a flight of stairs in your home 5 to 15 times, then recover for 1 to 2 minutes and repeat for 3 to 5 rounds. Second, you can do 10 to 25 bodyweight squats with 1 to 2 minutes of recovery and repeat that for 2 to 4 sets. And third, you can also do 5 to 15 incline push-ups on your countertop at home or on a plyo box at the gym. Rest for 1 to 2 minutes and repeat for 3 to 5 sets. These are just a few ideas to show you that it doesn't take much to start building muscle and strength throughout your body if you don't know where to start. And video links are included in the show notes so you can check out the proper form before you do them. Next, let's say you're a novice with resistance training. You have some experience with basic exercises, but you're not really seeing much progress with muscle size and strength. Chances are that you may not be lifting heavy enough weight to see the progress you want. You're staying within your comfort zone. I've seen this a lot as a trainer. The reality is that resistance training is difficult, and many people simply do not want to push past their comfort zone for one reason or another. If you want to increase muscle size, you will have to challenge your muscles to a point where it is uncomfortable, meaning you're feeling a significant burning sensation in your muscles and you might even start to shake, but not necessarily go to failure. This requires an ideal combination of weight, typically between 65 to 75% of the maximum weight you can lift for that exercise, and repetitions, typically between 8 and 12. If the weight is too light, you will not generate the required amount of tension and damage in your muscles for them to break down. And if the number of repetitions is too low or too high, you will not create the required metabolic disruption within your muscles to stimulate a strong muscle building signal. Here are a few examples of changes you can make to your exercise routine to build more muscle. First, say you're doing dumbbell bench presses. If you're doing 15 or more reps, the weight is too light to build any significant muscle. So increase the weight that keeps you in the 8 to 12 rep range. Second, say you're doing bodyweight lunges. Hold one dumbbell in each hand and do split squats instead for 8 to 12 reps each leg. And third, say you've been doing endless amounts of crunches. Instead, anchor your feet down and do sets of 10 to 15 sit-ups while holding a weight on your chest. And if you want to increase muscular strength, you should be lifting weights that are above 80% of the maximum weight you can lift for that particular exercise. Here are a few examples of changes you can make to your exercise routine to build more strength. 1. Say you've been doing the leg press machine for a while. Stop doing that exercise and begin to develop back squats with a barbell and progress from lighter weights to heavy weights where you are really challenged by doing 6 reps or less. 2. Say you've been doing bodyweight pull-ups for a while for high repetitions. Grab a weight belt and start doing weighted pull-ups between 4 and 6 reps. And 3, say you've been doing bicep curls for a while, but aren't noticing much improvement in your overall upper body strength. Switch to a bent over barbell row with a supinated grip, that's palms facing forward, with a heavy enough weight to challenge you for 6 to 8 reps. All right, let's say you're more advanced with resistance training, but you've hit a plateau and you're not really progressing that much anymore with your muscle size or strength. If muscle size is your goal, here is something you can try. Try increasing your overall volume. If we're considering the term volume in the general sense, that's a product of the weight you're lifting, the number of repetitions, and the number of sets. But volume is sometimes used interchangeably with the term tonnage, although they are not necessarily the same thing. There is some conflicting information about the two terms, but I think differentiating them is a bit more helpful for the advanced lifter. If you want to split hairs a bit, for the advanced lifter, volume is unitless, and it's a product of sets times reps without regard to the weight lifted. For example, if you did 3 sets times 10 reps of barbell back squats, your volume would be 30, no units. But if you added weight lifted into the picture, you are now talking about tonnage, which is a more precise measurement of mechanical stress on your body that you can use to progress your training more effectively. For example, say you're doing barbell back squats again for 3 sets times 10 reps at 135 pounds. 135 pounds times 10 reps equals 1,350 pounds lifted, and then 1,350 pounds lifted times the 3 sets equals 4,050 pounds lifted, which is your total tonnage for that exercise. So, if you're plateauing in your muscle building progress, make sure you're keeping track of your tonnage and focusing on increasing mostly the number of sets you're doing. The weight and repetitions completed have a much more narrow range to stay in. So, although those can be changed a little bit, increasing the number of sets will give you the extra stimulus you need for more muscle growth. Now, if muscle strength is your goal, as an advanced lifter, you should definitely at least have an estimation of what your 1 rep maximum is. Or you should test it periodically if you have spotters and you could do it safely. Once you know your 1 rep max number for typically one of the big 5 lifts, that's back squat, deadlift, bench press, overhead press, and the pull-up, Then you can begin to program your weights, reps, and sets more effectively. To build true strength, you should be completing very few sets, like 1 to 3, of very few reps, again 1 to 3, at very heavy weights, above 85% of your 1 rep max, with long rest periods of 3 to 5 minutes. If you're not doing that, then you definitely will not be as strong as you desire to be. Keep in mind that these are very strenuous workouts, and you should be following a very structured program with dedicated training cycles to achieve these heavier weights. But if you push yourself hard enough and recover appropriately, you will notice that your strength gains go through the roof. If you want to try one of my free workout programs to build your strength, try my Leg Fit program to increase your squat and deadlift, or try my Shoulder Fit program to increase your upper body pressing and pulling strength. Both of these programs are linked in the show notes. Okay, let's finish the episode off with some actionable information you can use to maintain your muscle flexibility and mobility, because as you know, your muscles need to function well and be pliable enough to make sure you're staying injury-free while you make all those gains. As you break down your muscles and build them back up, they can get a little stiff, and you might start developing some aches and pains as a side effect if you're not keeping your muscles and your joints loose and mobile through stretching and self-myofascial release, or SMR. I'm not going to get into the deep science of how these work in this episode, but to keep it simple, they work by maintaining an optimal relationship between the length and tension within the muscle and making sure that the layers of the superficial and deep tissue are able to glide and slide past each other appropriately. Here are a couple general guidelines you can adhere to when implementing these two types of mobility training into your workout routine. 1. Save static stretching for after your workout. Static stretching is what you're doing when you passively move your muscles into a lengthened position and hold the stretch without moving for at least 30 seconds. This is a good way to release tension in your muscles after they've been trained hard in your workout. You can do this with bodyweight stretches or use a tool like bands to help facilitate a deeper stretch. And you could find a link to my stretching playlist on YouTube in the show notes. And 2, use a foam roller prior to your workouts to generate some warmth and blood flow to the muscles that will be trained. This will create some movement within those tissues and prep them to start generating more dynamic contractions that you will be using in your workout. This is also an effective way to release any unwanted tension in certain areas to allow your joints to move through a full range of motion and reduce the risk of sustaining an injury. You can also find a link to my SMR playlist on YouTube in the show notes. All right, that's all for today, Wolfpack. Your action items have been sprinkled in throughout this episode, so choose one and get to work on it to start optimizing your health today. And remember, just because these action items are meant to help you build muscle and strength, don't forget the numerous other health benefits you gain from having additional muscle and strength, like surviving extreme stress and trauma, preventing non-clinical and clinical obesity, and reducing the risk of insulin resistance and diabetes. If you're liking the content, please follow and rate the show on Spotify or leave me a review if you're listening on Apple Podcasts. I would also love for you to leave a comment about additional topics you would like to learn more about in the areas of fitness, nutrition, stress management, or psychology. You can also find me on social media on Instagram at coach_awolf and YouTube at Wolfpack Fitness. Thanks for listening. Go get your action item done and tune in for the next episode. Take care. Thank you for listening. If you like the content, be sure to follow my podcast, leave a review, and check out the show notes for additional details and links discussed in this episode. My mission is to provide you with actionable knowledge in the areas of fitness, nutrition, stress management, and psychology. It is often said that knowledge is power, but I like to say that knowledge applied is even more powerful. Take what you learned today and find a way to apply it to your lifestyle so you can continue living your best life. Thanks, and be sure to activate the new episode notifications to be the first to learn about new and exciting content. See you next time.